Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I want to continue with working with restorative dentistry. And sometimes you restore with part of the natural teeth, and then you have to finish it up or something with restorative regular dentistry. You mix the two together. So this is why I say that restorative dentistry should be a part of the regular restorative dentistry. I mean, it's just a part of it, and put that part in there and use it. So let's see what we came up with this young man. I haven't looked at some of these cases for a long time, but I'm going to just run through what we did with this particular guy. And he's a young fella, and we'll go ahead and get going on this. A nice looking young guy, and he's got several teeth missing. He's got other normal orthodontic problems in there. He's got a closed bite. He's got a diastema in the front part of the mouth. A whole bunch of things here that you can lump together, and you just, as you do these other things, just restore what teeth you can with his own natural teeth, instead of extracting them and throwing them away or something like that. Use them and bring them forward and fill up the gaps. So let's get in this. So you look at it. There's several teeth in here that are missing. Okay, and we've got some undersized teeth. That's this lateral. I forget whether it's a baby or not. Let's look at the x-ray first and see. Now on the bottom we were missing the lower. We were missing lower bicuspids or lower molar something in here. And so we went in and cut the deciduous tooth halfway in two, like it would be going back in here. And we take this half out and do a pulpotomy on this part right here. Let this tooth drift forward. If you just extract the tooth, the top up above will drop down, and this tooth can't drift up here. So this is what I call driftodontics. Just you do this early and you see this happening, and so we came in and have just sectioned this deciduous teeth, did the pulpotomy here, let this tooth drift forward. When it gets up there, then you take this piece out right here, and this tooth will hold the top tooth from dropping down, and that's another trick we'll show. And I'm trying to get across that restorative dentistry is just a part of regular orthodontics, and it'll be taught to do this orthodontics like that. So watch this again. And we do all these things in little bits and pieces in various cases. We do that. Now let's look at the x-rays and see. He's 13 years and 3 months old. So here are some of the things we elected to do. All right. As far as I can tell, this is a defective tooth right here. And so we're wanting this tooth to erupt in here, and we'll shape it up like a lateral, I guess, if we need to. And we'll let this one come in and shape them up like laterals. Now, down here, this is something else I wanted to do, what we call driftodontics. You go in there real early, and you know this tooth is missing underneath here. There's no question about it. And so we section this tooth right through here, take this part out. Now, if we took the whole tooth out, this tooth above would drop down in the hole, and it would keep this tooth from drifting forward. And this is an excellent thing. This is all part of just orthodontics. And you go ahead now here, and we'll take this out, and this part holds this tooth where it is and keeps it from drifting down. And then you can take a long time doing this. You look in there, well, this thing is a messed up tooth, so we take it out and just get rid of it. And then we can shape the cuspids into laterals. And so let's see what we did here. All right, that's this is 12 years, 1974. We were doing this stuff 30 and 40 and 50 years ago, and it still hadn't caught on like I wanted it to. And this is a kind of a follicular deal here. We got this tooth out, this will start down, and then we'll take the baby tooth out and bring the cuspid up. Now here, watch this. Now we're going to section that tooth, do the pulpotomy, and I've done thousands of those pulpotomies, and I've never had one of them go bad. And you can't use a rubber dam when you're doing this. You've got to get down in the tissue way below here to cut that tooth in two and take this back half out. And we leave the gap, and then this will drift forward. And so we're filling that in where that tooth is missing. Then this tooth will come in behind that, and we will come, and we're missing the tooth up here, and that'll make it match up. All right, let's get on from there. And this is age 9 and 3. This is 1991. So we still haven't sectioned that out or taken those teeth out. Now they'll come in. Let's see where we're going. All right, we took this out over here. Now this tooth is holding this up. This piece is holding this up. This anterior part's keeping that from dropping down. This tooth will loom over in this hole, what we call driftodontics. And when it goes back, now this was like 95, January 1895, when that was done like that. And now let's see what happened. All right, here we have the 12 of 95, and this tooth has drifted under here, and this one has come down now. This tooth will hold this space up, so we'll take this out. Same thing over here. Take that out. Now this tooth will come in, and of course we held it, it's drifted underneath here. Now you can take that out, and this will continue to drift. Oh, that driftodontics. All right, now the cuspids are coming in up next to the centrals, and you can shape them up to look like laterals. Now we've got this tooth all the way up. We've got some space in here. We'll close that. And if we'd had some lower wisdom teeth, we might have got them, brought them in further. They'd have a better chance of staying, but there's no wisdom tooth there. But you could have put a wisdom tooth in that area. All right, we've closed that together. Now here's what we started out with, and there's what we came to this point, and we'll come in and trim the tip of this cuspid off, and maybe take a little bit off the sides, and level it a little here, and make that cuspid look like a lateral. And there it is from the side. The other side. Now we open this bite a little bit by putting a bite plate in the front part of the mouth to open it up. Now, here's the 6-year molar coming forward, and it's drifted up here. I hadn't touched it, and this may have taken a year or two or something for this to go, maybe longer than that. You don't have to see them, but very once in a while with that while this comes forward. That's all the way. Now when we get here, then we need to get this out. Now we'll let this tooth come up to here. And we set that up there and start doing some active orthodontics. We'll start pulling this here with keeping it parallel. I mean, the roots coming out together with the crown by bringing the root forward and putting pressure on it. We'll have to show you how to do that later. And now we'll close this space. Now we've shaped these cuspids up to look a little like laterals. We've leveled this out. And we did all this while you're doing the rest of the orthodontics. So we didn't have to add anything other than you may have put something back where the wisdom tooth was, but here's this young man smiling there, and that's the end of it. But here's the dental where we got with this place we are missing teeth in here and back in the other part too. So this is what I'm talking about when I say mix restorative dentistry with orthodontics. Just because we call it something different, it's just more of just regular orthodontics. There's no big mystery to it. And so we could provide somebody that's skilled enough to do this and start it, and you carry it on into adulthood with many of these cases. So I thank you for watching. I'm sorry I don't have a finishing picture of this young man, but if I went back here and looked at it, I mean, you can see what the teeth look like here, and that's further on down the line. But I thank you for watching, and don't be afraid or thinking you can't change some of the things that we've been doing, but you can add to it with just mixing restorative things with orthodontics. So thanks again. I'm going to close out now and say goodbye and be back in here. I hope you'll join our group and subscribe to it, and we'll see you later, hopefully.